There is no clinical fluorescence presentation through the VELscope VX that is definitely positive for dysplasia, oral cancer, inflammatory oral changes, or any other type of oral disease. It's important to understand that the VELscope VX is not a diagnostic test with a positive, negative, or yes-no answer. Similarly, the conventional intraoral exam does not yield a definitive diagnosis from only the visual appearance under white light. The white light exam and the VELscope VX exam are analogous procedures with comparable objectives: the discovery of potential abnormalities that may require further investigation. The power of the VELscope VX is its sensitivity to detect subtle mucosal changes that help clinicians detect abnormal areas that might have been overlooked during the conventional exam. The best way to categorize what you see through the VELscope VX is in terms of normal and abnormal patterns of fluorescence. Abnormal tissue typically appears as an irregular, dark area that stands out against the otherwise normal fluorescence pattern of surrounding healthy tissue. Sometimes, however, an area of normal tissue may exhibit a combination of bright and dark areas. Try to develop an appreciation for normal patterns of fluorescence by using the educational material provided with your system, combined with your own clinical experience and common sense. The contrast between normal and abnormal patterns of fluorescence, as well as an appreciation of the underlying physiological structures, will assist you in differentiating between healthy mucosa and areas of concern that may require further action. Now that we understand the concept of normal variation, let's take a look at oral tissue under white light and VELscope VX. This is a normal floor of mouth. Sometimes the area around the sublingual gland can be well vascularized and can lead to a loss of fluorescence that represents vascular variation and not pathological change. On the other hand, the floor of the mouth is a common site for development of oral dysplasia and oral cancer in patients with a history of excessive use of tobacco and alcohol. That area deserves careful visual and VELscope VX observation. Sometimes a normal oropharynx can host varying numbers of lymphoid aggregates, which, due to tissue structure, display a pronounced loss of fluorescence that does not signal serious pathology. On the other hand, a patient with a history of risk factors such as tobacco, alcohol, STDs, or immune system suppression is at higher risk of malignant disease of the aerodigestive tract, including the oropharynx. The presence of an irregular zone of loss of fluorescence should never be ignored. Pigmented tissue, such as this example of an amalgam tattoo, appears dark under both white light and VELscope VX. The buccal mucosa is a common site for irritation and consequent inflammation. Inflammation always shows a distinct loss of fluorescence because of increased blood content. The intense inflammation associated with erosive lichen planus results in a pronounced loss of fluorescence. Note the hyperkeratotic area on the ridge. If this lesion showed increased fluorescence, it would most likely be a simple case of uninflamed hyperkeratosis. In this example, however, the area shows a strong loss of fluorescence and is, in fact, dysplasia. If a suspicious area is discovered, re-evaluate under white light and VELscope VX, trying to identify what might have caused the region to appear abnormal. Take into consideration its appearance under both VELscope VX and white light, its response to palpation, as well as patient history information, including risk factors. In addition to the detection of dysplasia and cancer, the VELscope system is a valuable tool for the discovery of conditions that may not present with obvious oral change when viewed under white light. either because the condition is in its early stages or because the nature of the lesion masks the underlying inflammatory change. These conditions may include viral, fungal, and bacterial infections. Inflammation from a variety of causes, including lichen planus and other lichenoid reactions. Traumatic lesions and localized areas of trauma. Squamous papillomas and salivary gland tumors.